designed to support joint comfort and mobility. For bulk purchase, you contact TACO office on 0244 871 862 and Okaishi Drag Lane on 0244 683 583. Cancer mixture, a world devoid of sickness. We'll step into the clinic, but before that, we'd like to give a special GTV breakfast shout out to Kwame Osei Sapon. Of course, we're wishing you an amazing week and, of course, an amazing year. In the clinic, we are going to be talking urinary catheter injuries, which are complications arising from improper insertion, prolonged use, poor hygiene, or incorrect catheter selection. And in studio to have this conversation with us is Dr. Lemuel Davis Bray. He's a urologist with Tema General Hospital, and of course, he's been a guest here, a very special guest. Good morning, how are you doing?
Good morning, how are you doing?
I'm great.
Yeah.
Okay, so today our conversation is on catheters.
Yes.
First, what are catheters? Like, we think of these things as long stuff that's just been,
Yes.
put into different kind of holes in our body. True or false?
Yes, you're right. So, catheters are, long tubes.
Right.
They are flexible tubes that are put into the body. It could be any part of the body. So we could put a catheter into the bladder to drain urine. Okay, we could put a catheter into the stomach to drain, stomach contents.
Okay.
Sometimes we maybe have tiny catheters we put into the blood vessels as well.
Okay.
So catheter just refers to a tube. Usually they're a flexible tube that is put into a compartment of the body, for, the purpose for which it is put there. All right.
Okay, so I was going to ask that. Why would you need to put a catheter anywhere in the first place?
That's a very question. Very good question.
In the first place.
Yes, we are going to go through the process. Why do we need it? How it should be done? What are the complications and all that? It was very, very important. This catheter business is becoming something concerning to those of us in especially urologists in our field, because we are seeing a lot of complications from catheter insertion and proper use of catheter, right?
Doc, hold on to that. Hold on to that. I have to go through where we're going to go. Our lineup again. Guys, we're taking a quick break from urinary conversations and catheter conversations. And today the headlines will be featuring Dr. Palgrave, Wachid Dankwa, and a host of other people. We'll be having conversations on things and events that are trending. So our WhatsApp number is 0555536 134, and that's how you can contact us. We are going back to Dr. Lemuel. Apologies for that. We needed to take that. Right. Yes, okay.
So you asked why would somebody ever even
need a catheter in the first place, yes.
One of my mentors and teachers at Kolebu, Professor Che, made a business because it's really causing a havoc. He made a profound statement. He said that he's always been advising the female medical students that when the suitors, the would-be husbands, come to their parents to ask for the list, you should after the list, the parents have given the list, the lady, the female student, medical student, should always take a pen and write under the list, add catheter.
Why?
Why? That's a very good question. And this is metaphorical. It's just to tell you that at certain points in life, sometimes the use of falling on a catheter could be indispensable. And our mothers or our grandparents know it. Most times when our fathers or grandparents get to the point where they are having issues with catheter, then they have to grapple or contend with the use of catheter. Yes. So it's to avert your mind that, it may be of importance someday, so that you can always have to maybe pay attention to it. Okay, so going back to the question, why the use of catheter? We use catheter for several reasons. All right, we can even use catheter for children. Sometimes a child may be unconscious, and you don't want the child to, wet himself. So you put in a catheter to keep him dry. Sometimes the child may be sick, undergoing surgery, general anesthesia has to be put to sleep. So catheter is used there. Sometimes catheter is even put there to monitor the urine output. Even in females, yes, especially in labor, when the bladder is so full, it may compress or narrow the birth canal. So sometimes you put in a catheter to drain the urine momentarily to allow full passage. There's this myth in certain communities that they say that, if you're a man and you're having a catheter, it means that you are or you were a womanizer. Yes, so females can even have catheter. It is not a man's thing. That's the point here.
Right.
All right. Yes, and usually the female will have a single type. You see.
So are we dispelling the notion that catheter is not just used when you're about to go in for surgery?
No.
Okay.
We have patients who have injuries, spinal injuries, and they are paralyzed down there. they are continuously leaking urine on themselves, or they will be in retention, you put catheter in to keep them dry.
Okay, Doc, so let's go back to the most common conditions where you would need to use a catheter.
All right.
Yes, and then we go to the...
Yes. So in my practice, my trade, the most common condition will be men who comes with retention because of prostate issues.
Yeah.
That's the most common condition. I mean, so most men will come to the hospital, I mean, in severe pain because they are not able to pass urine. And then you have to put in a catheter to drain the urine. So that's the commonest condition.
Okay.
And then when I also perform surgeries, because we deal with the genital urinary. So most times, anytime we perform surgeries, we also put in a catheter to drain the urine, or even to act as a stent to keep the anatomy of the construction you have done till the healing is complete. So we use it as a stent or as a drainage device.
Okay.
Yes. So the catheter is a medical device. All right. And we have different types of catheters.
I see a lot on
Yes,
our desk, and I'm excited. Let's go through them.
Let's go through and give you the principle.
Right.
So, before you pass a catheter for any patient, the first thing you have to avert your mind is, why are you passing the catheter? For what purpose? What are you anticipating to drain? Okay. All right, and how long you intend to do it? So for the example I gave you, women in labor, you put in something like this. These ones, it is a single use, single channel. You put it in, drain the urine, and it's out. So it's a one-time use.
Okay, Doc.
All right?
Right.
So this is not self-retaining.
Okay.
All right? Yes. And these things are normally made of what you call vinyl chloride, PVC. Okay. So it is hard and durable. So this type is only for single use. So if you intend to just go in once and drain it, and you don't intend to put in a catheter again, this is where you choose this.
And so this can go in for to drain the urine from a man, and then also from women as well. So this is unisex.
Yes. Okay. But the reason why we may not use this for a man is that, like I said, for people with prostate condition, sometimes after you drain the urine, you have to keep the catheter in. And this thing will not allow you to keep the catheter in because there's no connecting valve. I'll show you what the connecting valve is. So this is for the ones we just drain in, and you don't intend to keep the catheter. You're just doing a single in and out drainage. All right?
It's one time use.
Yes. And then there is this one. Now you see this one have two openings. All right? So with this, means that when you're going with this, you intend to keep the catheter in. And I'll show you something. So what you do is that...
What's the longest a catheter can stay in?
4.
Yeah, in 4.
It depends on the type of catheter. Sometimes it can stay in for as long as 3 months. You understand?
3
Especially,
months.
yes, when they are made of silicone. This is the silicone, the transparent one.
Okay.
They are very inert.
Okay.
So hardly do they react to the skin. Unlike the latest one. This is what we call the latest one. So you see the latest one. Usually you see it in this yellow. So this is the latest. It's made of latex, but mostly they are coated with silicone. You know, because some people have allergy or reaction to latex material. Some people, when you even put adhesive plaster, you see their skin start reacting. Okay. The same way, if that person has that allergy and you put this in the urethra, the person will react to this catheter.
Okay.
And the whole urethra, the whole penis will be stuck, held onto it.
My goodness.
And that means that we have to perform surgery to remove this and now recreate a new channel, a new tube.
I hope that doesn't happen often.
It happens once in a while. Okay. I did copy one about 2-3 weeks ago.
And the man is okay?
He's still he's still recovering. Everything's in there. So we are here to remove the catheter. Normally we keep the catheter in for about 4 weeks before you take the catheter out and see what happens. Okay. Right? So sometimes it happens, especially the inferior ones. Some of these things are not quality, but if you get a good one, it's good.
But this is not over the counter at a pharmacy, right?
Yes.
So how would you have access? Why would somebody get a fake one?
Yeah, I mean people buying it are not buying quality ones. You know, sometimes even the hospital procuring units may not necessarily, avert their mind to the quality. Okay. They may go in for the cost instead of the quality. Okay. You understand? Yes. And so this is now what we call the indwelling one. Okay. If you are passing this one, that means that you intend to keep the catheter in. I'll show you. So you see, there's a bulb.
Yeah.
Balloon. Okay. You see? Yeah. So once you inflate this balloon, and the catheter is in there, it will not fall out. Unlike this one, where there's no chance for you to inflate any balloon. So this is single use and come out. Okay, hold on.
So for it to stay in there, you put it in when it's straight, like this?
Yes.
And then you inflate it.
Yes.
for it to be like balloonish like
Yes.
this. So this is what holds it in there.
Yes, so
And
that
this
doesn't
stays
fall.
in there for
Yes.
3 months?
Yes. So if you intend to keep the catheter in, usually we'll keep it in 2 weeks, 3 weeks and change it. But like I said, it can go as long as 3 months if it's silicone. Yeah. So if you intend to keep it in there, then that is where you use this type. That's a two-way channel. But if you are doing just drainage, you do this one. Now, what do you use? So we are going to go through the process. This is the catheter. So this is the eye. There's a small hole there opening. So that's where the urine will pass and drain and come out through this. This place is where I inflated the balloon. So that's the bulb. So no urine will come through here. So the drainage will come through here. This is only, it's like a retaining valve. All right? Yes. Now, you pass the catheter in and then you fill it with saline, water. All right. We don't advise that you use saline. When you use saline, saline means that salt solution, crystal. When the saline stays there for a long time, you can have crystals forming in. You understand? Then when you are draining the catheter, because you have crystals, stones formed from saline, sometimes you may not be able to deflate the balloon entirely. So if you use saline and you keep this catheter in for a long time, this is one of the complications you may have. So that's why we don't advise that you put saline, but rather you put in sterile water.
Okay.
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 So we are still in the business. So some people will also put in air, like I just did here. Yeah. But air is not the best. If you have a balloon and you put it on a swimming pool, what do you think the balloon will do? It will be floating. Yes, the same way. If you put air into this tube, into the bladder, it will be floating. So whatever you are draining may be down, and this is just floating on it. So you may not have adequate drainage.
Okay. So hold on. So for somebody who has to keep the catheter in for, say, 3 months,
yes,
will the person have to go in and out of the hospital to drain it, or the person can do it at home?
Yeah. So for the drainage, we're going to connect the catheter to the urine bag.
Okay. So this is where you see people
Yes.
with a
So
bag.
this is inside, and this is the urine bag. So the urine will flow and come here. When this one is full, the person will open this one out, and then he will drain the urine.
Okay. So the person would not even touch this.
He won't touch this. So this one, he will go to the hospital to change it. But what he will change or drain is the outside one, the urine bag. And this brings me to another important area. Sometimes, when some of our clients come to the hospital, they don't want this long one because it's discomforting. It's hanging in there. Everybody will see that there's a problem. So they'll prefer that you rather make it short. This is why sometimes people call it a stopper, but the real name is called catheter plug. All right?
Catheter plug.
Yes.
Okay.
So most people want this one, so that's short. Nobody sees it. But sometimes, when you put this one for a patient, connect this to a patient, you may rather be causing a harm to the patient. Now, when we say catheter injury, it is not always that you have to see blood, you have to feel pain, that you are causing injury. Sometimes you can cause injury to the patient by loss or damage. There's a condition we call chronic retention. Those ones, when the catheter the bladder is full, they don't feel any edge. So their bladder is distended like a pregnant woman. They don't feel any edge at all. And then the urine starts moving upwards into the kidney. All right? So when you connect the catheter to the kidney, you call it high pressure chronic hydronephrosis. So it means that these people, anytime they are in chronic retention, and you come and you pass the catheter, you need to connect the urine back so that the catheter will flow out continuously to release the pressure on the kidney.
But isn't the main reason for putting the catheter there
Yes.
is to drain the water out?
Yes, we have certain group of patients, you put the catheter in there for them, but they are able to have the edge, the ability to, you understand? Just that it's blocked, it's not coming. So when their bladder is full, they will feel the edge and they can open this one out, the urine comes out, then they put this one out. But we have certain groups of a patient like that. When he came to me, the power of the kidney is supposed to be 89 and above. His power was around 4. And he had this catheter with this for almost 1 year. Every year he goes to change it. I don't know how often he was changing it. But when he came to me, all I had to do is to change this one to this one. And within about 8 months, the power of the kidney rose from 4 to about 42. Just changing this to this. So sometimes the harm caused to the patient is not only the bleeding, it's not only the pain, but just because of deciding between this and this.
Okay, but across Ghana, would every patient who needs to use a catheter, would they have this sort of advice from medical personnel there and sort of, let them know exactly what A is and B is?
Unfortunately, that's not the situation. When they come, oh, he's my headmaster, he's my MP, he's my lawyer, so I want to make... So there's this saying that the road to heaven is paved with good intention. Unwittingly, you think you are doing good, but you are causing harm to the patient. You are being nice by giving the patient a short catheter. Oh, daddy, this is good for you. Yeah, you understand? And the patient also says, oh, you have been kind. But sometimes it's rather this the patient needs. And some of my patients, as I speak to you now, I have a patient whose son is a doctor.
Okay.
When he came to me, I told him that you don't need this. What you need is this. He thought that he could use his son because his son is a doctor to get his way to get the shorter one. I said, Father, there's no bargaining about this. This is what you need.
That's it.
So I was assertive. And he's it started with 17. Now we are almost around 32. Only about 2-3 months now. I'm hoping that the kidney will go, the function will go up. Then when it gets to the highest normal level, then I'll perform surgery for him. So sometimes you have to let them know. Once you let them know, then they will be. Other than that, everybody's what easy and comfortable to it. And that's why the health professionals too, sometimes they need to know that for people who come with chronic retention, they always need this. So I teach my students that if you're not sure, then always put in this, because you are always going to get it right with this one.
Right, yeah.
If you're not sure, always put in this. All right? So that is it. So the catheter also comes in sizes. Now, all the catheters, adult catheters, they are very long. All have the same length. So usually about 40 to 45 centimeters. Do you know the length of the longest penis, the man with the longest penis in the world?
No, doctor.
Yes, it's around 37 centimeters. He's called Matba. Yeah, his penis, he says, is about 14.5 inches when it's erected.
Huge.
So that means that man, even when you put this one in, it will go, because 37 centimeters. And most of these things are 40 to 45 centimeters. Okay. So most of the adult catheters have the same length, but the difference is the diameter. So this, for instance, is 16 French, and it's color coded. So 16 French is what? Orange. Okay. All right. Yeah. Then you have 18, which is red, but it's the same length. We have 20, which is yellow. We have 22, which is violet. Different colors, but the same length. So the question is that why is it that some are 16 and they are all even numbers? 12, 10, 14, 16, 18, 20. So when will you choose 16? When will you choose 18? When will you choose 20? The diameter. So it depends on what you are expecting to drain. Okay. If you are expecting to drain urine is like water. So for adults, can you put in a 14 catheter? The smallest, the better. Because if the catheter is small, there's less risk of injury. There's less risk of pain. Assuming I'm putting this catheter in the urethra, and I'm putting another one like this, which of the two do you think is likely to cause injury?
The second one.
The second one, because this second one will touch the side of the catheter. It can poke the side of the catheter, cause pain, can cause injury. But if this one is freely floating, it's less easy to touch. So for urine, the smallest the catheter, the better. And when you say small, it's the diameter, because all the lengths are the same.
Right. So has there been a case where you put in a catheter and realize it's the wrong diameter, maybe bigger or smaller, or too small, and it's taken out and another one inserted? Most
of the patients, when they come, the reason why they will want you to change is because they will tell you that the catheter is leaking. Yes, but I'll tell them that for urine, it's always the smallest, the better. There are several reasons why the catheter will leak, will go to that side. Okay. All right? But if you have a patient who you are expecting to drain blood, sometimes it can be draining blood. The patient is coming, is bleeding, draining blood or pus. You won't put in a system.
So what conditions would you need to drain? The most common conditions would you need to drain blood or pus?
Usually, if a patient has prostate enlargement, they can cause them to bleed.
All right.
And for those ones, because blood is thicker than urine, you don't want to put in a system. You want something which is wider. So this, for instance, is size 24. It's big.
And it has 3 valves as well.
3 valves, and I'll tell you why it has 3 valves.
Okay.
So this one is bigger than this. So when you are passing these two catheters, which of the two is more likely to cause injury?
This one.
This one, because this is bigger.
Bigger, yeah.
You understand? Yeah. So that is why we will pass this one when we are expecting to drain blood or pus, something which is thicker than urine, so that it can pass out easily. If you go and pass the smaller one and you are draining your blood, it may not flow. So before you even decide the type of catheter you pass, you should anticipate what you're expecting to drain. That's one of the important principles I want to say today. Because if you don't avert your mind to that, you go and pass this one and realize that it is blood. Then you remove this one and go and pass this one.
What does it do to the patient?
It can
remove.
Yes. Let me give you this scenario. If Ghana goes plays Nigeria in an AFCON final and we win 1-0, and then Nigeria says that, oh, the referee was biased, we should come back again and come and play. Do you think Ghana will go and play? Why?
We won already. We
But why
defended.
won't you go? We won, so we can win again. Why won't you? Because the win or success is not guaranteed. When we go, they may score us and we lose the cup. The same thing. When you put the catheter in and remove it, and then you want to go and put this out, you are not guaranteed of success. In going with this, you may go and injure. So once you pass the catheter in and it's in, we guide it cautiously. Guide your win, guide your success. So that's why we want you to attempt less often. So know what catheter you want to use and go in with the right system and do it once.
Okay.
To reduce the risk of injury. So if you know you are expecting blood, then you go in with the 3-way. You don't go in the 2-way. Come in. We say 2-way because it has 2 valves.
Yes.
This is 3-way. This one, the reason why we say it's 3-way is that you see, because you are expecting blood, when you inflate the catheter, and then the catheter is in, you may have to be washing. You may have to be washing the bladder. As in, be draining the blood in there, because some of them they have blood stuck in there. So you need to be irrigated. For you to pass your water or your to just wash inside. So if you intend to do the irrigation, that's what you do this.
The
Yes.
3-way.
So if you go and pass this when you need a patient who needs irrigation, this one only drainage. There's no channel for the drainage. So this one has to come out and this. And we want you to avoid going in and coming in, because it can cause injury. So the size of the catheter, when you talk, they say 16 French, 18 French, 19. When you say French, is 0.3 millimeters. 1 French is 0.3 millimeters.
Okay.
So the bigger the size, the bigger the diameter, but the length are the same. So you go in for the bigger one, 20, 22, when you are expecting blood, pass. But for urine, it's like water. So 16, 14, fine. And we are saying that the smaller the catheter, the less the injury, the less pain.
Okay.
Now, the next point is, when you pass the catheter, you're supposed to pass the catheter with saline. What do you call it? Gel. This is a gel. You see, usually you want to put this one into the penis. Okay. You inflate it in the penis before you pass the catheter. Now, this is another area. This is 10 mils. You are supposed to pass all this into the penis. So if this is a penis, you are putting all that into the penis. Milk it all the way, so that before you come and pass your catheter.
Okay.
Why do you think that is so? Because we want the catheter to swim into the bladder.
Easily.
Yes, easily. But when it goes to certain places, these 10 mils will be used by 10 patients. So every patient will get 1 mil. You call it aliquot, tot, la hypothesis.
I mean, doc, patients need to know this.
You see, this is going for about 70.
Guys, take your notes.
This is going for about 70 or 80 Ghana cedi. So most patients may cost become issue. But if you go for just the aliquot, the tot, and your penis is injured, the surgery that will perform for you will cost you more than 10,000 Ghana cedi. And this is just 70 Ghana cedi. So you are supposed to infiltrate all this. Allow some time. This is lidocaine. It has both lubrication and analgesic effect.
Okay.
That means that both for the pain and then for easy passage. So you pass everything in there and then wait for some time, about a minute or two, and then try and glide your catheter in without any firm pressure. Just allow it to just glide in. You understand? All right. Some people will use what we call the KY gel.
Okay.
This one is also will give you lubrication, but to not give you analgesic effect, no pain effect. It's only for lubrication. So comparing lidocaine and KY gel, this is better because you get two things: the pain effect and then the lubrication.
Analgesic.
But this will only give you lubrication, no pain. And even this one, if you want to pass it, I always teach you take everything out. If pump it up, pump the whole thing, 10 mils, put it back, hold the penis, and then infiltrate the whole penis with the 10 mils.
So this you put it into the
space.
space.
The tip, yes. So you don't go and do that tot 1 mil and then you just put a drop like this and you're going to pass. When you do this, the risk of injury is high because the penis is not lubricated enough. All right. Last week I had to perform 2 surgeries. In fact, about 3 months now, this is what I've been doing. Almost every week I perform surgery for people with bulged catheterization. Last week I did 2. Tomorrow is my theater day. I have another 1 on the list.
Why? What's happening?
Like bulge catheterization, the procedure is, I have a patient. So in my facility, I've told my doctors there, when a patient comes and you pass the catheter, keep the catheter in. Don't remove it. Because more often than not, the conditions that precipitated retention may still be prevailing. So give the patient some time, about a week or 2. Treat the underlying condition, before you remove the catheter. But sometimes some of the patients, when they come, they are, excuse me to say, a bit stubborn.
Yeah.
Once you drain the urine and they are relieved, they want the catheter out. Everything you say, they don't want it out. So there was this patient who came, and then when they passed the catheter, they relieved the urine. He was fine. He insisted that they should remove the catheter. And they told him, here we don't do that because it's not the best for you. He said, no. I know my rights.
Yeah.
And then, yes, you have your autonomy. So they remove it. Unfortunately for him, in the middle of the night, he went to retention. He couldn't urinate again. And they rushed him to a nearby hospital. When he got there, it was not lucky. They trying to pass the catheter for him, they injured the penis. He started bleeding. They decided to rush him back to Temajena Hospital. But he said that he was not going to come because he knew what he had done during the day. Earlier. So they should send him to another hospital. When he went there, he was in severe pain. So the health professional there also wanted to help him. So he also decided to try and pass another catheter. Double silencer. So double jeopardy. But if this man had kept the catheter in for about a week or two, he would have saved himself from this misfortune. I also had a client. He came from UK, came to bury his mother.
Right.
The night he was about to leave Ghana, he went to the retention. He came to me, I passed the catheter for him. And I told him, since you are going back this evening, it's better to keep the catheter in. Because when you get retention in the air, unless the flight attendant there use straw to drain your urine for you. The man insisted he didn't want the catheter. And about 1 hour before the flight, he went into retention. They rushed him to airport clinic. There was a delay, so the flight left him. So the following day, he came to see me to write a letter to his airline for him to get a new date. When he came, he said, "Doctor, you are a witch." I said, "I'm not a witch. I told you that this is likely to happen." You understand? Yeah. So most men will not want the catheter for whatever reason, but sometimes it may be your best safeguard.
Yeah.
All right?
Yeah.
Yes.
Yeah. Doc, I think you need to come back for a part 2. We need to come back for a part 2 of this because we need to be guarded as patients and then know what to do at all. Thank you so much for this conversation.
Thank you.
We've been having a conversation on catheter injuries, urinary catheter injuries, I beg your pardon, the causes, symptoms, prevention, and why you need to keep it in there. If you want to know, get back to the conversation, it's on our Facebook page, and then you can go back and know and learn what you need to know. Thank you. We're having this conversation with Dr. Lemobre, urologist from Tema General Hospital. We'll take a break. On return, there's some sports.